With the beginning of the coronavirus pandemic, the number of patients with herniated intervertebral discs, spinal canal stenosis, and hip coxarthrosis has increased significantly. First of all, this was due to the strict isolation regime, which led to a sedentary lifestyle. Among other reasons that have an adverse effect on the musculoskeletal system is a decrease in immunity, which occurs as a result of the infection. During the pandemic, specialists note that in patients who have had COVID-19, inflammatory processes in the joints and spine have worsened precisely against the background of a weakened immune system. The increase in the incidence of the musculoskeletal system and disorders in the work of the musculoskeletal system are also associated with the inability to get to a doctor's consultation in time. On the side of the musculoskeletal system, patients who have had COVID-19 may experience both moderate and severe pain in the joints and muscles. It sometimes makes it difficult to move around, especially if physical exertion is excessive. The most common symptom of coronavirus on the musculoskeletal system is increased fatigue, even 3 months after the onset of the disease. Moreover, it is experienced by more than 50% of patients. The insidiousness of the disease is also that it affects and changes the work of many body systems. Thus, it is necessary to be extremely careful and attentive to the amount of physical exertion that you put on the body. Scientists have found that the new coronavirus infection triggers a mechanism similar to the process of developing rheumatoid arthritis. The immune system produces antibodies that attack the healthy cells of its own body. Muscle pain appears. The deterioration of the condition is facilitated by accumulation of toxins formed after the death of infected cells, long-term use of antibiotics, antiviral and symptomatic drugs, decreased physical activity, increased body weight. The risk group includes people with immune inflammatory rheumatic diseases, arthritis, arthrosis, rheumatism caused by other causes, chronic diseases that require long-term anti-inflammatory therapy, elderly patients. According to WHO statistics, women are more susceptible to post-COVID joint syndrome than men. Post-COVID rheumatoid arthritis often requires long-term treatment, including drug therapy, physiotherapy, and exercise therapy. Main symptoms: joint enlargement, redness of the skin, pain at rest, increased fatigue, movement disorders, joint stiffness in the morning, increased body temperature. Joints hurt after COVID most often at rest, but active movements can aggravate the symptom. Such a pathology worsens the patient's quality of life and in severe cases leads to disability. The effect of coronavirus infection on the body has not been fully studied, so the doctor prescribes a course of treatment only after examining the patient. The immunopathological process does not resolve on its own, so a comprehensive treatment regimen is required. Usually, drug therapy, physiotherapy, and exercise therapy are sufficient. But in advanced cases, only surgery can help the patient. If the first alarming symptoms appear, you should immediately seek medical help.